Hello, Eddie.
Good afternoon, Governor.
Good afternoon. Good afternoon to everyone. Thank you for joining us for today's COVID-19 daily update. I'm joined, of course, by Dr. Jose Romero of the Department of Health as Interim Secretary, and I also have Ms. Stephanie Williams here, who is the Chief of Staff. And I first want to thank the Legislative Council of the General Assembly that today passed out two appropriations or multiple appropriations for needs in our state in terms of contact tracing, particularly at the minority populations, but also broader than that with the Department of Health. This was quick action on their part. I'm glad they passed that out today and want to express my appreciation to them. Let's look at the cases today. Today we have an additional 734 cases, which brings us to 40,181. When you look at our hospitalizations, we've increased 12 hospitalizations to 501, and which is a plus 12. And then in terms of our deaths, we have an additional 20 deaths. That brings us to 428. And so these are not good numbers whenever we've gone over the 40,000 mark cumulative in terms of our total cases. When we've gone over 500 in our current hospitalizations, these are both high water numbers for us. And of course, having an increase of 20 in terms of our deaths is not good news as well. If you look at the top counties, it breaks down very broadly with 11 counties having more than 20 cases, and so they're spread out, with Pulaski County having 55, Benton County having 50, Mississippi County 48, Sebastian 45, and Washington County was tied at 45 with them as well. Polk County 36, Faulkner County 34, and then it just goes on from there. But you can see the breadth of the spread in terms of the number of counties in Arkansas. Our tests, we did 5,248 tests. Not bad. We'd like to do more, but that's the testing over the last 24 hours. If we go to our graphs, we can see where we are in terms of our cases with over 734 cases in the last 24 hours, which is down from the peaks. The number of days have been higher than that, and it's sort of flat. But Arkansans, it is too high. We need to get that number down more, and I think we understand that. And then if you go to the next one, is the going back to the rolling average. You can see that we flatten out, and then we go back up, we flatten out. And so we have work to do. And then the next one, on our hospitalizations, we're back up to that high level at 501 hospitalizations. And then if you look at our active cases, we're not at our peak on active cases. We have a number that have recovered, and so that's a little bit more positive news there. And then if you look at our testing results, and once again you can see that the red line is our commercial labs, and our commercial labs are still slowing down some in terms of our production. We want it to be higher. The Department of Health is back up to a more normal level there, and they continue to produce. And then if you look at where we are in our testing for the month, we're at 170,000. We're going to easily achieve the 180,000 mark, which is 6% of our population. And so our testing is in pretty good shape compared to the nation and compared to the goals that we have set. We obviously wanted to get to 200,000th month. We'll see if we get there, but we should make the 6% of our population this month. And then in terms of our positivity, again, we're down below the 10% positivity rate, and so we're making progress on that positivity rate. We want to do more, but that's that's better news than what we're seeing there. And then here's the 7-day rolling average of our positivity case, which is probably the most instructive because it averages out over 7 days, and that decline, that small decline, is good information and good numbers. And this is something new I've asked the Department of Health to do. We're going to have to spend a little more time studying this, but I asked for information in terms of the positivity rate by the county of residence. And so it's small for you to see, but you can see by the color code, but the red is a higher positivity rate, and then the lighter shades are a lower positivity rate. If you look at Van Buren County, it's a 3% positivity rate, but if you look at Benton County, it is a 8.1% positivity rate. Sevier County, where we've struggled a little bit, 17.6% positivity rate. This is helpful to us as we make decisions on our testing, on our focus, on resources, on our as we measure schools. If they have a positivity, if they have a positive COVID case in a school after it starts, how do you respond to that? Some of it will be the extent of spread in the community. This gives us that information. Now we need more information in this because this is a cumulative total from day one as to what the cumulative positivity rate is, and I want more contemporary numbers, so it might be the positivity rate over the last 2 weeks or the 7-day rolling average. And so we continue to work on the data to give us more information, and I think the public wants this because you can look now at the county and you can see what the positivity rate is through history. You can see the number of active cases that are in there by county, and of course ACI has been a good partner that will help give us some of that county-wide or city-wide information on their cases. So we're continuing to refine the information to give that to us. Now, one other thing I want to say about trying to get more information is, as you know, we have these tests, which are PCR tests based upon the makeup of the virus itself. And then you have the antigen test that do not have quite the same level of accuracy, but it's still in the 95% range of accuracy, and it's very, very helpful, and our pharmacists are utilizing that to make it available as a point of care. We've ordered 200 of these machines. As we get these antigen test results in, we want to be able to have a separate graph and a separate finding and presentation on those numbers so that you can distinguish between our PCR test that we've historically reported on and our antigen test that will be separately calculated, but it'll still be good information for everyone. So that's something that we'll be presenting in the future that will shed more light on where we are and how much testing that we're doing and how that's available across the state. With that, Dr. Romero.
Thank you, Governor. So to add a little bit of a fine point to what was already stated, our new cases were 734. These were distributed as 714 in the community and 20 correctional, for a total case number in the state of 40,181. Our active cases are 6,565, distributed as 79 cases in nursing homes, 225 correctional facilities, and 6,261 in the community. Currently hospitalized, as mentioned by the Governor, 501. No change in the number of individuals requiring ventilation. It is 110. And deaths were 428, an increase of 20. Testing, as stated, we have performed on the 27th, 5,248 tests. The health department is now consistently above 1,000 and is doing 1,365 for that day. The commercial private laboratories had 3,400 482, which is significantly below what they were contributing before, and the University of Arkansas for Medical Sciences, 401. The counties have already been explained, so I will end here. Thank you, Governor.
With that, be happy to take any questions.
Do you have the recovered numbers for today?
Give Dr. Romero a chance to get that. While he's getting that, is there another question?
Well, I guess too, in terms of the contact tracing, are we seeing that be effective due to some of the lagging in testing? I know that was a big topic of discussion this morning in ALC, but are we seeing contact tracing be an effective strategy still, despite some of those testing numbers taking a while?
Absolutely. Absolutely. And for that reason, as I pointed out yesterday, you don't see any states, even though they struggle just like we do in terms of timeliness on some of the testing results, nobody's moving away from contact tracing. It's an essential investment that we have to do because it still makes a difference. And we're getting some test results within 2 days, some 3 days and 4 days. That's still very useful. We still have to be able to follow up with the contact tracing. We learned from that, and we also are able to give isolation instructions to prevent the spread even further than that. Dr. Romero, do you have, and you might want to comment on that and then give that data.
So, yes, so you are correct that a delay in receiving the positive result will lead to a delay in talking to the individual and identifying those contacts. But it's still important to go through that and to look for those cases. We need to try to track them down, yes. With regard to the question that you asked, specifically recovered 33,188, and that is an increase of 823 from yesterday.
Dr. Romero, can you go over what it means to be recovered? What are your guidelines?
So, so that means that they have moved past the period of isolation. They are off the period. Now, those periods change depending on how severe the infection is. So it can be anywhere from 10 to 20 days.
And does the health department do any long-term monitoring to see if additional effects from it, impacts show up?
No, we do not follow them after that period of time.
The 20 new deaths occurred within the past 24 hours, or were some of those late reporting?
So some of those are late reporting. 6 of those are late reporting, and there's no clustering that we can find.
Let's go remotely. Is there any question remotely?
Yeah, Governor, this is
for Dr. Romero. Could you give us a lay explanation, please, between the difference between a PCR and an anagram test and how that data is used?
So just to clarify the question. So you want to know the difference between the two tests and then how the data is used. Is that correct?
Yes, sir.
Okay. So so again, without getting too much into the weeds, so the virus is essentially a ball of protein around genetic material like DNA or RNA. The PCR test looks at the genetic material, so the RNA in this case of the virus. And the antigen test looks at the protein, the shell or pieces of the virus itself, right? And then, of course, you have the antibody test, which is actually a protein made by the host, by the individual, against the virus. Now, how are they used? So the CDC defines a case as a conclusively positive case of COVID if they have a positive PCR test. It's a presumptively positive test at this time if they have if the individual has a positive antigen test, if you find the protein in the individual's nose, which is usually where you look for it.
Neil, I'm just disappointed you didn't ask that question to me. Is there another question?
Governor, this is James White at the newspaper up in Harrison.
I was going to check on the status of care being done at the Newton County Nursing Home. Our Department of Health staff on scene at this time, and have all staff and residents been tested and have those results returned?
Do you have any information on that?
They are being tested. I'm sorry, I don't have the information regarding whether all these tests have returned. We can certainly get that information for you if you further wish that.
Governor, this is Jamie Weiss with 4029 News. Was curious if you or Dr. Romero could explain why there is such a lag in testing and why, as you mentioned, some people are able to get the results after a couple of days, whereas others could wait up to a week to get their results?
Yes, that's a very good question, which is why is there a lag in getting the testing results? And first of all, the bulk of our testing results, probably at least 60%, come from commercial labs. They're across the nation. There's about 6 of them. And so individuals from California, Texas, Florida, all are flooding those 6 commercial labs to get testing results. And so that huge backlog has increased the delay. Now, one of the reasons it varies is that you might have one lab that can get it done in 2 days or 3 days. Another one has more backlog, and so that takes 4 days or 5 days. And so it's just dependent upon the backlog of the commercial lab, which we have no control over in Arkansas. Now, you know, and the decisions on which commercial lab to use is not made by the Department of Health. It's made by each individual hospital or other care facility. And so they will try to shop around to get the most responsive commercial lab that can supply their needs. Our job is pushing, from a federal standpoint, more resources to those commercial labs that are nationally have the backlog so that they can produce and meet the needs that we have. In terms of the Department of Health and their turnaround time is generally 2 to 3 days. We monitor that and there's always exceptions to it. Sometimes one gets lost in the system or it doesn't get a quick turnaround. But by and large, it is 2 to 3 days that we try to do with our Department of Health resources.
Governor, it's Rolly Hoyt with TH11. Yesterday, Dr. Romero got a tough time from some lawmakers over mandates, and then today, Ms. Williams got some tough questions over the money that's being asked for. And a lot of those lawmakers represent, they say, constituents that are fearful about the government, about you, telling them what they have to do and the length of these mandates and how they don't see limits to them at this point. How many people are out there, do you think, are like that? And how much work do you feel you have to do to kind of reassure those people?
Well, of course, that's what is expected if you go into a legislative hearing, that tough questions are asked, and they're representing their constituents as to questions that some of them want to have addressed. And this is exactly the reason that I hesitated and did not want to have to issue a mask mandate. But again, when you see the cases go up, the hospitalizations go up, what's happening with our healthcare workers, the pressure that they're under, it was a decision that had to be made. And so it's just simply the responsibility of the chief executive, the governor of the state, to have to make some of those tough decisions and to be held accountable for them. But I hope everybody sees that we do not issue restrictions on businesses lightly. We resisted the stay-at-home order. We resisted shutting down businesses. And when we could, we lifted the restrictions. So it's a matter of balancing, the priority on public health and getting a handle on the cases and the deaths that we see from the virus with the independent spirit of Arkansans and the freedom that they experience. I identify with that. I don't like it either, but we pull together, we work together to get over this, and by and large, I think that most Arkansans understand what we're doing and the need for it. That's why they're wearing masks. They're wearing masks because they know it is needed. I think the secondary reason is that there is a mandate for it, but primarily because it's needed, and that's what helps people be safe and to get through this. The next question.
Governor, this is Jacqueline Froelich with Ozarks at Large in Fayetteville, KUAF. A popular biker restaurant in Eureka Springs called the Rock and Pig has posted a sign that says masks are required, but patrons and staff have the right under HIPAA and the Fourth Amendment to not wear one. Of course, HIPAA is a law for healthcare providers to secure health data, and the Fourth Amendment prohibits unreasonable searches and seizures. Add to that State Senator Bob Ballinger recently posting on Facebook regarding your mask mandate that liberty lost is seldom reacquired without violence. It's time that citizens take control of their government. So I'm following up with the previous reporter's question. How can you quell concerns by residents who feel this is a government takeover of personal rights? Thank you, Governor.
Well, I don't think it's the time to take up arms, and I certainly hope that's not what the senator expressed. I think that's an adage that has been expressed in times past during the times of the American Revolution. But, you know, in terms of, again, Arkansans are doing the right thing. You know, we see great levels of compliance. We would like to see more. And, you know, as someone said, if you want to have school this year, if you want to have sports this year, the best thing we can do is to wear a mask, to socially distance, to protect others and protect ourselves, and to make sure we don't add to that spread. Let's reduce those number of cases. Let's reduce the positivity rate. So by and large, that's what I believe Arkansans understand and want to support, and they understand that I have to make those decisions for the good of the public health with the guidance of our public health team. All right.
Governor, this is Joe Flaherty. My question is specifically for Dr. Romero. And Dr. Romero, on June 9th, one day before Governor Hutchinson announced the statewide move to phase 2 of lifting restrictions, you privately cautioned Dr. Nate Smith via email that pushing to phase 2 for the entire state could lead to significant increases in cases that could overwhelm the healthcare system. You said the public seems not to have taken seriously recommendations for social distancing and masks. And he also suggested that the governor might need to be more forceful in his recommendations on masks and distancing, and that he also might need to backtrack on reopening if there's a major surge in cases. So the question is, given the current trajectory of the outbreak, do you think the governor made a mistake in going to phase 2 statewide contrary to your gut instinct at the time?
So that wasn't a gut instinct. That was based on current data at the time. No, I do not think the governor made a mistake in going forward. And he has continuously increased his support for masks, as has been shown from this podium, to the point of issuing a mandate when the public did not seem to be taking this issue seriously. The mask mandate is essential to bringing this under control. It seemed that, to me, the public was not taking this issue seriously, despite having multiple recommendations by the governor to engage in using a mask. I think that the recommendation was appropriate, and the governor, is monitoring the situation closely as well as the health department.
Going back to the question from Ozarks at Large, I believe, which asked a very aggressive question on how in the world can we impose such a mandate. Well, if you go back prior to the mandate, you're asking just the same aggressive questions on the public is demanding to have masks. The mayors are demanding a mandate. And so that's the kind of public debate, that's the kind of public divide that you have on this, and so I'm used to having to make some unpopular decisions, but it's necessary again for the public health. Any other questions?
Yes, Governor.
Well, we got one at the table, please, Jay.
So I guess we're getting into August now, and obviously the big topic is going to be contact sports. Have you given that any more thought? Kind of when can we maybe expect a decision on that, if there's one pending?
We have given it thought. We have had discussions with AAA, the Arkansas Athletic Association. Department of Health has worked very hard on this, and at this point, the teams are allowed to do non-contact drills. They're allowed to do certain things under the guidelines, but in terms of full contact sports with where we are right now, we're not ready to move. Hopefully it'll get better, but at this point the message is they can train, but we're not engaging in full contact drills right now. Hopefully that will get better down the road.
And I guess too, I understand it's only been a week since we've had the mask mandate in, and maybe this is more for you, Dr. Romero, but is there a timeline that we should start to maybe see some results of a mandate?
The answer is, generally speaking, and UAMS modeling pointed this out, that you generally start seeing results 2 weeks after the mandate is put into place. And of course, it depends upon the effectiveness of the mandate. I mean, if everybody ignores the mandate, it's not going to make a difference. But if people actually wear the mask, which I believe they are by and large, you should be able to start seeing some results after a couple of weeks. We'll see, but it takes compliance, it takes people doing that and understanding the importance of it. There's another question remotely.
Yes, Governor, this is Jared Ferguson. Just to follow up on your antigen answer of Governor Dr. Romero's, if the antigen is a presumptive positive, what's the reason for doing that? Are the reagents easier to get? I'm trying to understand why we would be going there.
Why would we go there? Because first of all, it's point of care. You don't have to send them to a commercial lab that it might take 2, 3, 4 days to get back. It gives you an immediate answer and immediate guidance. And so that's the primary reason that you would utilize those point of care tests, the antigen test. That's why we've bought 200 of them. These are the same tests that the federal government is sending to nursing home operators in hotspots. And so they're utilizing that because it's a quick turnaround, particularly whenever you're utilizing or giving it to staff and others that need that quick information. But because it is presumptive, we are putting it in a separate category so we don't confuse those statistics with the PCR test. Did you have anything else to add on that?
No, that's exactly right.
All right, one last question remotely. I think I heard somebody.
Yes. Yeah, thanks, Governor. This is Garrett Ferguson with KNWA News in Fayetteville. I'm not sure if you're aware, but there's a Springdale-based testing company that has developed a rapid COVID-19 test that can give results in 15 minutes. On Monday, they were approved to send their test to 28 countries in the European Union. They did file an emergency use authorization application with the FDA. Are you in talks with the FDA to expedite that application?
Well, the FDA is expediting these applications. I don't think my leverage would necessarily make a difference because they really are trying to move these out in a safe manner. There's been another one that actually has been approved, but you're saying this one has not been approved by the FDA yet. I'd be glad to help on that, but I just need to have more information on that. Thank you, and tomorrow we will be in Russellville for our daily broadcast, sort of our midweek break, and then we'll be back here latter part of the week. Thank you.